begin. Hi, my name is Laura and I'm going to be conducting a physical assessment on you. Do you mind telling me your first and last name along with your date of birth?
Yara Beckerty, 05/26/1999.
Okay, do you mind telling me what you prefer to be referred to as?
Just Yara.
Okay, just Yara. Do you mind telling me what your pronouns are?
She and her.
Okay. So I'm going to start by talking about your physical appearance. Yara is alert and oriented. She's conscious. She appears to be well groomed and maintains well nutrition. Her speech is clear. I don't notice any physical deformities, and she is sitting upright. She appears also to be calm. Next, I'm going to be assessing your skin. So I'm going to be looking at your shoulders and I'm going to be inspecting them. What I'm looking for is any discoloration, any bruising, lesions, anything like that, which I don't notice. Next, I'm going to be assessing your face and your head. Face appears to be symmetrical. Do you mind? We're going to test cranial nerve number 7. Do you mind smiling? Okay, face is symmetrical. I'm going to be palpating her head for any bumps or lesions. I don't feel any. It appears to be round. Next, I'm going to be assessing her eyes. I'm going to be first starting about the external portion of her eyes. I'm going to be looking at her eyelids, her eyelashes, and her eyebrows. Eyes and eyebrows appear to be symmetrical. Her eyelashes are full and long. I don't notice any patches of hair missing. I'm going to be talking about your internal eyes. Your sclera is white, iris is brown, and I'm going to be taking a quick look at your conjunctivitis, which is pink. Okay, next I'm going to be performing Perla. I just want to see that your eyes are brown, equal, and reactive to light. So do you mind looking straight at my nose? Okay. So pupils are equal, round, and reactive to light, and now I'm going to be testing for accommodation. Do you mind following my pen light? Okay, eyes accommodate well. Next I'm going to be doing the corneal light reflex, and I'm going to point a light in one of your eyes, and I'm going to be checking the opposite eye for it to be dilating. Okay, one more time. Okay, so eyes seem to accommodate well. Next I'm going to do the 6 cardinal positions, and so I'm going to have you follow my pen light. You're going to go okay, eyes seem to accommodate well. I'm going to move on. I want to palpate real quick your frontal sinuses. Let me know if you feel any tenderness. Any tenderness on your maxillary sinuses? Okay, I'm going to move on to your nose. No, I'm going to inspect it first. It appears to be mid-light. I don't see any occlusions. I'm going to palpate. Okay, nose is symmetrical. Did you feel any tenderness? All right, and we're going to be checking for patency. So what I want you to do is I want you to block off one of your nostrils, and I want you to breathe in and out. Okay. Did you have any trouble breathing? Did you feel for any occlusions? No. Okay. So we're going to move on to your ears. So I'm going to view the external portions of your ear. They appear well. I don't see any drainage. They look symmetrical. Next, I'm going to be palpating your tragus and the other portion. Did you feel any tenderness? No. Okay. So I'm going to move on to your mouth. I'm going to be inspecting your lips, your tongue, your gums, your palate, as well as your teeth. So your lips appear to be pink. We're going to test cranial nerve number 5. Do you mind clenching your teeth? Okay, and we're going to test cranial nerve number 12. Do you mind sticking out your tongue? Okay, so I'm going to inspect inside your mouth. Do you mind opening up for me? Okay, so tongue is pink, gums are pink, teeth appear to be intact, and palate is also intact. I don't notice any redness, any lesions, or any abnormalities inside her mouth. We're going to be testing cranial nerve number 9 and 10, and basically I'm going to have you say ah for me. Okay, so tonsils are present. I would grade them a +1, and they are pink, and her uvula I did notice movement and it was symmetrical. So we are going to move on to your neck. So next on your neck, I'm going to be inspecting. I don't notice any lesions or anything of the sort. I'm going to start by palpating her carotid pulses one at a time. Okay, they're strong and bounding. And then I'm going to be palpating her trachea. Okay, appears to be midline. Next, we are going to test cranial nerve number 11. I'm going to press down on your shoulders and I want you to press up. All right, very well. And then I'm going to have you perform range of motion exercises on your neck. Do you mind putting your neck from ear to shoulder? Same, do you mind doing it up and down? Perfect. All right, left to right and around. All right, you got it. Next, I'm going to be assessing for the lymph nodes. So excuse me for any of them that I pronounce incorrectly. I'm going to start by palpating her preauricle, her postauricle, her occipital, her post, I want to say clearance, pre-clearance, her tonsillis, her premandibular, premental, and her supraclavicle. Did you feel any tenderness within those? All right, very well. We're gonna move down to your posterior chest. So I'm gonna have you kind of sit on the side for me. All right, do you mind lifting up your shirt? Okay, so I'm gonna start by inspecting. I don't notice any discoloration, no lesions, or anything of the sort. Her spine appears to be midline. Next, I'm going to palpate for expansion. So what I'm going to do is I'm going to place my hands on T9 and T10. Sorry if they're cold. And I'm going to have you breathe in and out when I tell you to. So go ahead. Okay, so my thumbs moved while they were on her back, which indicates good expansion. Then I'm going to percuss her lung sounds. So I'm going to press here. I'm going to do 3 on the lateral. Okay, did you feel any tenderness?
No.
Okay, next I'm going to perform the CVA, which is the coastal vertebral angle. What I'm going to be doing is I'm going to place my hand flat and I'm going to give it a little pound. This basically assesses for any kidney infection. If she were to feel pain, it could indicate possible infection. So I'm going to place my hands where I believe her kidneys are. Did you feel any pain? No. Okay. Then next I'm going to perform the tactile fermentation. I feel like I said that wrong, but I'm going to place my hands, and when I place my hands, I want you to say 99. 99, 99, 99, 99, 99. Okay, so I did notice some vibration, which is well, and while I was percussing her breath sounds, I did notice some resonance. Lastly, I'm going to auscultate breath sounds. Okay, do you mind breathing in and out as I do this? I'm going to do the lateral side, in and out. Okay, breath sounds appear to be clear. So next I'm going to move on to your anterior chest. I'm going to start by inspecting. I don't notice any lesions or anything like that. I'm going to auscultate breath sounds. And I also didn't notice any, she appears to be breathing unlaboredly. Chest respirations are even, no obvious signs of using accessory muscles. So now I'm going to be auscultating breath sounds. Okay, breath sounds appear to be clear. Next, I'm going to move on to the heart. So for the purpose that her shirt is on, we're going to do this above the shirt, but I'm going to be describing each process. I'm going to be inspecting for any pulsinations or deformities, which I don't see any. I'm going to be locating the PMI, which is also known as the fifth mitral valve, or intercostal space, I'm sorry, fifth intercostal space. I'm going to start from the top. On the right side, we have the second intercostal space, which is known as the aortic. The third intercostal space on the left side, which is known as the pulmonic. The third space on the left intercostal space on the left side is known as the Erb's point. Fourth space on the left side, fourth intercostal space, is known as the tricuspid. And then the last one is the fifth intercostal space, which is known as the mitral valve. So lastly, I also want to palpate for any heaves or thrills. Okay, didn't feel any. And lastly, I'm going to auscultate. Okay. I'm going to start with the second, third, fourth, wait. Okay, S1 and S2 are present. Okay, I'm going to be moving on to the abdomen. Do you mind laying down for me? Okay. Really quickly, I did forget to auscultate using the bell. So I first started with using the diaphragm, and I'm going to move on to the bell. Once again, we're going to do the second intercostal space, third intercostal, second on the left side, third on the left side, fourth, and the fifth. Okay, there we go. You can lay down, and I will. So I'm going to start by inspecting her abdomen. I don't notice any lesions. Abdomen appears to be flat. Umbilicus appears to be symmetrical in midline. I'm then going to auscultate all four